Hello and welcome to U plus AI's YouTube channel called Startup Reports. I am Ranga, and in this channel I review products and services from startups that are at the intersection of healthcare and artificial intelligence. In this episode, we'll take a look at Inform AI, whose mission is to advance healthcare through analytics. Now that's nice and simple. Let's take a deeper look into what they are doing. First, let's look at the problem that Inform AI is trying to tackle. So there are two things. One, Inform AI wants to help speed up radiology diagnosis. Now think about a radiologist's workflow. A radiologist is someone who typically looks at X-rays or CT scans or MRI scans and tries to interpret them and write up a report about it. Especially with CT scans and MRI scans, per patient, per scan, there are a number of images. So the radiologist has to make sense of this conglomeration of images and give a sensible interpretation. That certainly is quite a lot of laborious work. And think about in countries like India, where there are so many patients and so few radiologists, so definitely they have a packed day. So anything that can help them get this done faster is what Inform AI is looking to build. Secondly, Inform AI is trying to help avoid invasive procedures or tests for patients wherever possible. Again, this would be possible if they were to build a tool that offers an automated interpretation of a scan or a MRI, and then that sort of concludes that there is no need for further invasive procedures. We'll take a look further. So what has Inform AI built? The first thing they've built is called a paranasal sinus classifier. And what this is it's a 3D convolutional neural network, which is basically used for image recognition in AI. It is trained on about 6 million 3D CT scan images, and these are radiologist validated. And once trained, when a new image now is presented to the paranasal sinus classifier, it is able to classify it into one of 23 classes. And these classes are really paranasal sinus conditions. And so in that way, it's able to offer a quick interpretation of what the scan might mean. So what has Inform AI built further? So they've built another tool called the Brain Cancer Classifier. Again, it's a 3D CNN. This time it's trained on 3D MRI images and MRI images of the brain, I guess, when they do scans. And these are pathologist validated. And what this does is, when a new image or a set of images is presented to it, it can distinguish between several tumor types in the brain regions. And it can also tell whether, probably a tumor is going to be cancerous or not. All right. So again, it offers a quick interpretation of the set of MRI images of a patient. So what's my take? Certainly, these two applications do help speed up the radiology diagnosis. Like I said, anything to help the radiologists is probably welcome because they have a huge amount of caseload to deal with. That said, the question that arises is, are radiologists comfortable enough to use this tool? Will they feel confident enough that the diagnosis given by this tool is good enough and that they don't need a further look into by a human radiologist? Well, we'll have to wait and see. Certainly the accuracy would matter, the confidence score of the interpretation given by the tool will matter, and also the diversity of cases that the tool can deal with will also matter. Another question to think about is, if radiologists did have this tool, where would they spend their time? One possibility is that radiologists may help patients understand the reports, may help understand the scans and offer them their insights. Now, if you think about today, radiologists typically don't spend time with patients explaining their reports. That is done by their physician, and the report that the radiologist prepares is typically sent to the physician. So there's hardly any direct contact between radiologists and patients, but that may change with the availability of such tools to radiologists. My second take is that certainly with tools like the brain cancer classifier, if it can offer a quick interpretation, definitely it could save a lot of time. Imagine somebody coming with a brain injury as a concussion or an accident, and the radiologist is already has too many cases to handle. So how do you push this case to the top of the pile? Well, emergency procedures may dictate that, but still having a tool like this to offer a quick interpretation would certainly help. And such a tool could also give confidence to say whether a further invasive procedure like a brain biopsy is needed or not. And if it can be avoided, definitely it saves cost, a lot of pain for the patient, and not just the pain, but the further complications that can arise from the invasive procedures are also avoided. That said, we need to think closely about the notion of false positives and false negatives in this case. Now, a false positive interpretation by the tool may mean that someone who never needed a brain biopsy ends up having one. A false negative may mean that someone with a serious enough condition is not diagnosed by the tool. So these are areas where probably human radiologists will have to second the opinion of the tool and provide the right direction. So think of these tools as one more tool in the radiology toolkit, rather than something that could replace the role of human radiologists. Thank you for listening in. I hope you enjoyed that perspective. If you did, please like my video on the YouTube channel. Do connect with me, Rangaprasad Sampath, on LinkedIn, and follow my handle U+AI on Twitter, SoundCloud, and Medium. I'll see you again in the next episode. Enjoy.